Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT codes used to report this service. 73501, radiologic examination, hip unilateral with pelvis when performed, 1 view. 73502, radiologic examination, hip unilateral with pelvis when performed, 2 to 3 views. 73503, radiologic examination, hip unilateral with pelvis when performed, minimum of 4 views. 73521, radiologic examination, hips bilateral with pelvis when performed, 2 views. 73522, radiologic examination, hips bilateral with pelvis when performed, 3-4 views. 73523, radiologic examination, hips bilateral with pelvis when performed, minimum of 5 views. These views are used to evaluate the hip and adjacent structures. The number and type of views directly affect CPT code selection. Standard views: pelvis AP view, hip view, hip lateral view, frog leg or modified Cleaves method. Trauma views: hip lateral cross-table view, Danelius-Miller method, hip axiolateral view, Clements-Nakayama method. Alignment and structural assessment: hip AP oblique views, Dunn method, standard 40-40-20-80. False profile Friedman, specialized oblique rotation views, hip PA oblique, Shea method, Lilienfeld method, hip PA axial oblique, Teufel method, hip AP abduction internal rotation view, von Rosen-Eyre view. Radiology report order exam, hip 2 or 3 views, complete with or without pelvis right. Header: AP pelvis, AP and frog leg lateral views of the right hip, history. Follow-up fracture. Comparison: right femur radiographs 10/30/11/2022, CT 1/5/2022. Findings: healing right proximal femur fracture with intramedullary nail and cable fixation. 1 interlocking screw is broken, no acute displacement. Impression: healing right proximal femur fracture with interval hardware failure, broken interlocking screw. Let's look at the views. AP pelvis, AP and frog leg lateral views of the right hip. That's a total of 3 views. This qualifies for CPT code 73502, right? Radiologic examination, hip unilateral with pelvis when performed, 2 to 3 views. Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state: follow-up for healing the right proximal femur fracture. Hardware present with a broken interlocking screw. The most appropriate ICD-10-CM codes are S7 2.8x1D, other fracture of right femur, subsequent encounter for closed fracture with routine healing. The fracture is proximal, not neck or shaft, healing and follow-up status. And 84.122A, displacement of internal fixation device of femur, initial encounter. This code captures the mechanical complication of the orthopedic implant, the broken screw. This is the first imaging documentation of this hardware failure. Correct code 73502, right? Radiologic exam, hip unilateral with pelvis, 2 or 3 views. S7 2.8x1D, healing right proximal femur fracture. And T84.122A, displaced internal fixation screw, initial encounter. Radiology report order exam, hip 4 views, complete with or without a pelvis right. Header: AP pelvis, false profile Dunn and frog leg views of the right hip. History: chronic right hip pain. Comparison: MRI 11/8/2022, radiograph 3/24/2022. Findings: no fracture, hip joint aligned. Impression: unremarkable right hip. Let's look at the views. AP pelvis, false profile, Dunn and frog leg views of the right hip. That's a total of 4 views. This qualifies for CPT code 73503, right? Radiologic examination, hip unilateral with pelvis when performed, minimum of 4 views. Report findings state: chronic right hip pain, no radiologic abnormalities. The most appropriate ICD-10-CM code is M. 25.551, pain in right hip. Use this symptom code when no specific radiologic pathology is found. The correct codes for this report are 73503, right? Radiologic exam, hip unilateral with pelvis, minimum of 4 views, and M25.551, pain in right hip. Radiology report order exam, hip 5 views with or without pelvis, bilateral. Header: AP pelvis with AP and cross-table lateral views of both hips. History: bilateral hip pain. Comparison: none. Findings: mild bilateral osteoarthritis, left gluteal calcific tendinitis, ossified iliolumbar ligaments, impression, mild bilateral hip osteoarthritis, left gluteal tendinitis. Let's look at the views. AP pelvis with AP and cross-table lateral views of both hips. That's a total of 5 views. This qualifies for CPT code 73523, radiologic examination, hips bilateral with pelvis, minimum of 5 views. Report findings state mild osteoarthritis in both hips, calcific tendinitis on the left, no acute trauma or dislocation. The most appropriate ICD-10-CM codes are M. 16.0, bilateral primary osteoarthritis of hip. This code covers degenerative changes in both hips without a secondary cause, and M. 76.02, gluteal tendinitis left side. This code describes calcifications near the greater trochanter on the left side. Correct codes for this chart are 73523, radiologic exam, hips bilateral with pelvis, minimum of 5 views, M16.0 bilateral primary osteoarthritis of hip, and M76.02 gluteal tendinitis left side. Thanks for watching. Be sure to check the links in the description for helpful resources, and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.